So the first thing we're going to talk about is steps of arousal, because this is one of the important things that we need to understand for any dog or cat or human who's experiencing any type of fearful or anxious situation. And when we talk about arousal, we're talking about the level to which you react. So how quickly you react and the height and the level to which you react. So I think we have to ask, why does arousal level, the level to which you manifest any of your reactions and the rate and the speed with which you get there, why does that matter so much? Well, it matters so much because it's the key to what's going on in the sympathetic autonomic nervous system response. If you take a look at the picture of the brain here, what we're worried about is the response that is generated in the locus coeruleus. This is the norepinephrinergic system. This is the core of the sympathetic response system. So that as norepinephrine increases and is released from the locus coeruleus, you can see that the connections go to the HPA axis, the hypothalamic pituitary adrenal axis. So you go to the hypothalamic axis, which then stimulates ACTH, which then stimulates cortisol. And then cortisol increases reactivity through the amygdala, with later effects on the hippocampus and frontal cortex that actually reinforce fear and a stress response and inhibit learning that could aid in recovery. Because when these individuals have this profound stress response, if they've got any glucocorticoid receptors left, if they've got cortisol left, that all comes back and then affects how you form learned memory in the hippocampus. And we're going to talk about that in a little bit more depth. So how does this reinforcement of fear and the inhibition of useful learning help? So you're reinforcing fear, which is not helpful, which is the pathology here. But unfortunately, at the same time, you're also inhibiting any ability to recover from that fearful situation. So when we talk about how we learn, it's important to remember that the amygdala sits at the end of the hippocampal region. These are paired structures. You have one on each side of your brain. All associational learning occurs initially in the hippocampus. It's then projected to the frontal cortex. But if you're fearful, you will also, when you stimulate the amygdala, you will stimulate the learning of that fearful memory. What we would like for you to do is to be able to undo that by learning a contrary behavior. And this is all part of molecular learning or long-term potentiation. And long-term potentiation is the result of a number of environmental inputs. They could be sensory, they could be drugs, they could be stress, it could be talk therapy or cognitive learning. It could be a virus or a toxin that does this. Those affect whatever the synapse sees. You then stimulate neurotransmitters or receptors, ion channels. If you stimulate enough of those, you stimulate transcription factors. And the transcription factors then go to the promoter region of the genome for that area which it's going to transcribe and turns it on and says, please start making new protein. And that's how you make memory. We know that without making new protein, you have no memory. And we know that because if you give rodents in staged learning events, you give them a protein inhibitor, you then test them, they can't make memory. The individuals who got a blank and didn't get a protein inhibitor can learn, and they show you that they've learned new things. So this is a protein-dependent process, and when things go wrong in how you code proteins, you begin to have problems. So what happens to learning in fear and anxiety? One of the things that we just said is when you stimulate the locus coeruleus, you have norepinephrine increases, you have ACTH increases, you have cortisol increases. Cortisol is the hormone that everybody thinks of as increasing in a stress response, and cortisol can be extremely beneficial. It's the thing that protects you from a pain and acute stoppage in an emergency situation. So if your cortisol level goes up, you may be able to do things that you otherwise wouldn't be able to do, and you need some level of cortisol elevation to be able to learn. But if you take a look at this graph, as cortisol increases, the ability of you to have the TRAC kinases stimulate brain-derived neurotrophic factor, or BDNF, goes down. There is an intermediate level of cortisol that allows BDNF and TRK kinases to start to function. When you stimulate those receptors and you stimulate those second messenger systems, it's the TRK kinases and it's the BDNF that allow you to move into the nucleus of the cell and to explain to Krebs to start transcribing the genetic code one step of the code at a time. So you need an intermediate response of cortisol to get a decent response of BDNF. And then when you compare the level of Krebs, which is the red drawing, you compare the level of Krebs to the level of BDNF, you need a high level of Krebs to transcribe proteins, and you need a moderate level of BDNF to transcribe Krebs. So you need BDNF that's in a broad middle range to get a sufficient level of Krebs to transcribe these proteins. So when you look at this, really, the effects on BDNF are the effects of the stressor itself. If you look at the effects of cortisol, that's the effect of the stress reactions on your ability to learn. The effects on BDNF are the actual effects of the stressor itself. So these are two patterns that become very important when we understand arousal, because it explains why we don't want cortisol to be so high. You can get these same good results that will give you great protein levels that will allow you to learn without ever getting to the highest third of the cortisol range. So it becomes important to understand what happens when the cortisol level is too high, because in addition to needing a lower level to transcribe these proteins, if cortisol is still hanging around, it acts as a hormone response element. So what happens with Krebs is Krebs goes along the genome and it starts to decode and decode and decode and decode, and it goes along and it starts to make a protein, it starts to make a protein, and it transcribes some things and it transcribes some things. And if it hits a hormone response element that could be due simply to cortisol itself, it just could be a cortisol molecule sitting there, a glucocorticoid receptor sitting there. If it hits that, it stops transcribing, and now what you have is a non-functional protein. So you could have put in the effort to learn, but you can't learn. So this is why there's no sense to punishing an individual when they're aroused or trying to teach them complex tasks. It's why there's no reason to stress people when they're taking exams or when they're in courses, because they can't learn at that level. Okay, they can react. You can react in a stress situation. You can save your life. But if you ask people later what you did in that situation, they'll tell you and you won't remember, because you couldn't make the memory of that acute situation work for you, because you didn't have enough Krebs to be able to transcribe the protein. So glucocorticoid receptors matter. They can be affected in a long-term manner perinatally, or they can be affected through repeated exposure or through a traumatic event. So this could be when you're in utero, it could be before mom was even pregnant, it could be when mom had babies and she was stressed or she didn't get enough food. Any of those things can happen. You can be repeatedly exposed, as in a storm situation or a fireworks situation, or you could have one big traumatic event and the outcome would be the same and your arousal levels are too high. And the example of what happens to individuals who don't have the best upbringing becomes very important when we're talking about arousal levels, because when we're talking about fears and phobias, most of the data indicate that there probably is an underlying genetic liability for this. And in the gene mapping we've done, we found that that's true too, that at least 6 genes are probably involved, and if you get any subset of them, you have enhanced risk of reacting to noises in a painful and fearful way. So when we look at this, these show a line of rodents that are bred for high levels of maternal grooming. This shows a line of rodents bred for low levels of maternal grooming. So these individuals are otherwise the same, except they don't groom their babies as much. They're fed the same, they're kept the same. And what ends up by happening in the promoter region of the gene that you want to transcribe, and you want to transcribe this gene because it's going to make glucocorticoid receptors for you. In the promoter region, which is where Krebs would do much of its activity, in the hippocampus, you tend to have these methylated groups. These are things that happen as a result of stress, as a result of of accidents, as a result of just metabolism. They hang around. And what ends up by happening is that this individual who is in a high maternal grooming group is easily able to transcribe the gene. She makes lots of glucocorticoid receptors. The individual who is in the low maternal grooming group, well, those babies end up with huge numbers of methylated compounds on their promoter region, and as a result, they cannot connect the promoter region to the gene, and they don't make very many glucocorticoid receptors. They interfere with the ability of CREB to transcribe protein. So when you look at what happens to these individuals when they're stressed later in life, you see that the individual who had high grooming, they go through the stress event, the HPA axis goes up, the hippocampus becomes activated, they stimulate glucocorticoid receptor responses. Those receptors, they have loads of glucocorticoid receptors. Those receptors suck up the glucocorticoids, the cortisol, and they're able to stop the stress response. The individuals in the low maternal grooming line are always stressed. They have the same number of glucocorticoids circulating, but they don't have very many glucocorticoid receptors, so they can't recover from stress because there's always cortisol. And that causes a prolonged level of arousal. So if you think about a bad experience, a bad perinatal stressor, or a genetic predisposition to this, all three of those can function in having a profoundly adverse response to any type of noise or any type of stress, and a profoundly exaggerated arousal level. And when that happens, you can have varying degrees of these reactions to noise. Everybody doesn't have to be the same. The earlier you can intervene in arousal and modulate it, the better off we're all going to be, because if you look at this, this is an example of a response surface that shows on the y-axis the behavioral trait, on the x-axis the genetic trait, and the environmental effect on the z-axis. And you know, dogs may look completely identical behaviorally until you stress them. And then you expose both of these dogs to noise, and one of them begins to fall off the track. And then if you repeatedly expose that individual to noise, it gets worse and worse. So the earlier you can intervene, as this response surface shows, the better off you're going to be. So our focus should be on early intervention and on blunting arousal. So are clients able to figure out how well their dogs react? Can they do this adequately? Can they tell us when the dogs are aroused? Well, they may not be able to use those words, they may not be able to use those terms, they may not be able to tell us quantitatively, but we can educate them. The problem is really that we often don't know where their dog resides on the range of reactivities of dogs, because there has never been a standardized study where we've looked at age, sex, breed, and purpose and graphed dogs' reactivities in any one situation. So what we can do is collect a lot of data and just explain to them generally that arousal is the level to which you react and the rate at which you get to that level. And your reactivity is a function of the frequency, the intensity, the numbers and types of behaviors exhibited. So if you look at this example of arousal curves, and these are just response curves with a threshold level for your arousal written in. And if you look at time, if you look at A is a normal response. This dog's not distressed. He hears the sound, he processes that information, he comes to baseline. If he has any one of those liabilities we talked about, poor maternal care, stressed in utero environment, or he has a genetic predisposition, the next time he hears the noise, he may look more like B. Now he approaches the threshold for arousal, and he calms down, he comes down to baseline. But that's no longer true by the time you get to C. He's over the arousal threshold and the shape of the curve changes. And now it takes him longer to calm down. He still makes it to baseline. By the time he gets to D, it takes him much longer to calm down, and now he doesn't come back to baseline. And as you go further, these dogs now spend most of their time waiting for the sky to fall. And they're always at some level of arousal. And they're ready to react to even the smallest noise. So we can get what's called generalization, where a dog who might have only reacted to fireworks or storms now starts to react to loud noises in the street, now starts to react to truck backfires, now starts to react to you moving some furniture or loud sounds on TV. And these become real problems for the welfare of the dog. If reactivity, resiliency, and recovery matter, we need methods for measuring their response surfaces. And these two graphs here show you a normal dog and what happens when they react to something, and what we would call a reactive or an abnormal dog. When you look at this, the green regions are the non-reactive and normal attentiveness behaviors. The yellow regions are the monitoring and warning signs, and the red region is when the dog is reacting and distressed. So the proportion of time spent in these various stages is represented in these drawings, and you'll see that reactive dogs actually spend very little time being normal. It's only when these dogs begin to recover that clients understand they never saw this dog act normally. Now they see that the dog is happy and acting normally. They appreciate how distressed the dog was. So this dog spends very little time being normal, and the normal dog spends most of its time being normal. And then it begins to react, and it has a large period over which it monitors the environment. So that when you see a normal dog and they're in the arousal range, that range of arousal is much smaller than it would be for an abnormal or reactive dog. So you see that reactive dogs spend most of their time either waiting for bad things to happen or engaging in behaviors that make them think bad things have happened. If you look at the shape of the curve, normal dogs react very slowly, abnormal dogs react very quickly. The inflection point, the point at which you cannot pull them back with behavioral techniques, comes much earlier for reactive dogs or abnormal dogs than it does for normal dogs. And the time you have to intervene in the event is very tiny for abnormal dogs, and it's large in normal dogs. So our goal in treatment is to change the arousal levels so that this curve now looks more like this curve. So what can we change? So when we look at what we can change the rate at which they get to the inflection point. So we can change that part of the curve. And that's the preventive strategy. Or we can change the rate at which and the time they spend in the reactive zone. And that's the role of an interventional treatment. Okay, so when we look at these, if we want to do some preventative treatment so that we don't get to the part of the curve where they're likely to start to fire, that's the function of the locus coeruleus. That's the true beginning of the arousal level. That's the norepinephrine sympathetic response. That's where we're going to use alpha agonists. If you are to the point where you're spending most of your time in the zone where you're reactive, and the very steep part of the curve that's circled here in blue, that's a function of the amygdala, the hippocampus, and the cortical stimulation. And without tricyclic antidepressants and SSRIs, even if you also use alpha agonists, you're unlikely to change it because these individuals have to learn not to do that. So can you use an alpha agonist to bring them down to the other level? Of course you can. But if you want them to have the most profound effect, they're also going to have to be able to learn new ways of handling their daily life because, as we just explained, they're spending most of their daily life also not being normal. Okay, so when do we intervene and with what? When you're looking at the curves we already talked about as you begin to exceed the threshold level and you no longer return to baseline, when you're looking at A is the time to prevent this. It's when the dog is normal. That's when you want to intervene. At the most, you want to intervene at B. So that's your preventative strategy. Your interventional strategy is B through G. That's going to affect the level and reactivity of these dogs. So what you want to do to prevent things is intervene as early as possible, certainly no later than halfway through that B curve. And then you're going to go through these other curves. And that's when you're going to be in the interventional level. Now, there's a third thing that nobody thinks about with respect to medication, because people say, oh, well, it doesn't happen very often, I don't have to prevent it, and I'll just wait them out. Oh, please don't wait them out. Because the recovery rate changes with exposure. And at some point, and you see this in G, even if you wait them out, they can no longer recover, and their daily life is now miserable. So there's a real role for interventional therapy in recovery rates. And that's the third thing that nobody thinks about, and it may just be the single biggest reason to consider medication. because you'll help them to recover more quickly. They'll spend less time being distressed. They'll learn less about being distressed. And if you do the preventative strategy with the two interventional approaches, you will now be able to learn alternate behaviors. Okay, summarize. What did we say about arousal? The level to which you react and the rate at which you do so matters. If you can blunt or abort arousal, you change symptomology because you can change the rate at which distress occurs and allow for helpful interventions. The preferable approach is to prevent that arousal so that you have few difficulties with glucocorticoid responses and their adverse effects on learning. You would like not to have to keep trying to learn something and not being able to do it because the only thing you make is a non-functional protein which doesn't do anything for learning new memory. Interventional treatment favorably alters the recovery curve because of the additive effects as you're getting worse and because of the downslope effects on the recovery curve. All anxiety conditions are time penetrant, so that non-specific signs worsen and change with time, and they change in scope with exposure. So don't think it doesn't need to be treated just because it's early. That's in fact when I would rather see everything, and then no one would suffer. Treatment, preventative and interventional, is essential. This is all about allowing dogs and cats to be the best individuals they can be, to be their own best selves, to have them have the best quality of life they can, the best welfare they can, and to help them enjoy the best life with the humans who love them that is absolutely possible. And you can't do that if you're distressed and aroused all the time.